Amidst the ongoing strike of medical personnel and doctors to protest the horrifying rape and murder of a doctor in Kolkata, Thiruvananthapuram Lok Sabha MP Shashi Tharoor had brought to the notice of the government that there were rising cases of violence against doctors and healthcare workers. He took to X to remind everyone of the same. In February 2023, this is what he said in Lok Sabha.
The attention of the Honourable Health Minister towards the rising incidence of violence against doctors and other healthcare professionals in recent years. There's no central data on the number of assault cases against healthcare workers or health facilities, but the Indian Medical Association estimates that 75% of all doctors face some form of physical abuse during their service, with many cases of violence severely underreported. These are people who are selflessly serving our citizens and attempting to save lives, sir. Currently, no national level law comprehensively and categorically addresses this issue. State laws vary, the existing laws are weak in their implementation, lack scope to protect all healthcare workers. In fact, 11 states and union territories have no laws at all. In 2019, this government, sir, had introduced a draft bill titled the Healthcare Service Personnel and Clinical Establishments Prohibition of Violence and Damage to Property Bill, which would have made such violence a non-bailable and cognizable offence with a jail term of up to 5 years. But this was withdrawn by the government before it could be considered by Parliament without assigning any reason. Our healthcare professionals are neither adequately appreciated nor protected, and it's imperative to realise this is not just an issue for the medical fraternity. Violence against healthcare workers weakens our health system, sir, and affects the quality of services provided to patients, in turn leading to more risk of violence. Therefore, I urge the Health Minister, if necessary the Home Affairs Minister and the Law and Justice Minister, to reintroduce a comprehensive central legislation to put a check on violence against healthcare professionals at the earliest. Thank you, sir.
He had, about a year ago, even introduced a private member's bill to protect doctors and healthcare workers from violence. Tharoor again brought up the issue of the doctors' security in February this year as well.
Shashi Tharoor ji.
Thank you very much, Mr. Speaker. Sir, we all have to be very concerned about the rising incidence of violence in the workplace against doctors and healthcare professionals. In India, 75% of doctors have experienced violence, sir. And this is much more than most other countries in the world. In fact, younger and less experienced doctors are particularly vulnerable. In Kerala, we had a young 23-year-old doctor being murdered by a patient who was brought in by the police for her to treat. A recent survey by the Indian Medical Association showed that 82.7% of Indian doctors feel stressed out by the profession, 62.8% fear violence, and 46.3% say violence is the main cause of their stress. Now, I had raised this issue in a private member's bill. I got a very good reply from the Health Minister saying that we cannot have any legislation to protect doctors, because if we do it for doctors, tomorrow chartered accountants will want special laws, others will want special laws. Sir, but doctors are working on life and death matters. They're working with patients, they're saving lives. Risking their own should not be part of their profession, sir. I urge the government to reconsider the stand and to kindly introduce legislation that will actually protect doctors and other healthcare professionals in the workplace, and at the same time produce some financial or legal support to medical professionals who become victims of violence while performing their duties at the central level. This Dr. Vandana Das in Kerala was killed in a government taluk hospital. This kind of thing should not be allowed to happen, sir. The government has a responsibility, and I would urge the minister to change his policy on this matter. Thank you, Mr. Speaker.